Well, I reflect on NHS strategy broadly. I think, as I said, the value of cancer nursing is probably recognised. If you look at the RECaN project that Mary Wells was just talking about, you can see that the UK has a very high status. We produce lots of nursing research that we can't really imagine a scenario when specialist nursing and cancer nurses aren't involved with cancer care. But in other countries, they're at much sort of lower status. So I think in some ways we're doing really well. I think there are other things, and things like the cancer targets and things like that, keeping adjusting the cancer targets, and actually, even though there seems to be a dip in performance in cancer targets, so people aren't being treated as a timely way as they were, I think it's very important that we keep measuring that, because how do we know the quality of what we do unless we measure it? So I like cancer targets. I would hope those would continue. In terms of investment, the big problem in health services is about investment, and I think certainly in the last few years, after a long period of investment in cancer services, we've seen a period where there hasn't been not that much in investment, and obviously I'd like to see that change. And I think, along with many people, there has to be a conversation about how much cancer, how you want to pay. Do you want to pay more tax to have good cancer services? I would say yes, and I think most of the UK population would say that, but we're very rarely asked that question. I think there has to be more transparency about how things are funded, because if we want the NHS to continue, we want free cancer care to continue, we're going to have to pay more money.